Over the past several months, I've spent a great deal of time studying what it truly means to step in and manage finances for someone you love when they're no longer able to do it themselves. This is no longer just an academic topic for me, it's personal. Both of my parents are getting older, and for the last 2 years, my father has been living with vascular dementia. Watching that progression changes you. It changes how you think about responsibility. It changes how you prepare. My family and I have surrounded him with support. That includes helping oversee his finances and guiding healthcare decisions. And I've realized something through this process. Many of us don't fully engage with certain issues until they affect us directly. Once it becomes personal, you pay attention in a very different way. That's exactly what happened for me. I went all in on understanding this. Recently, I came across a statement in a book that made me stop and reread the paragraph. The author explained that one of the most lasting and often hardest to reverse decisions you'll ever make in retirement is choosing between a Medicare Advantage plan and a Medigap plan. That stayed with me. Two thoughts immediately came to mind. First, I realized I didn't understand this deeply enough. Second, I knew this conversation needed to happen. Because if you're making a decision at age 65 that could shape your healthcare for the next 20, 30, or even 40 years, that decision deserves careful thought. Hi, I'm Clara Morgan, and welcome back. In this video, I'm going to take everything I've researched and organize it into something clear and practical. Whether you're approaching Medicare yourself or helping a parent or spouse, I want you to feel steady and informed when making this decision. This will be a comprehensive discussion. That means it may run longer than some of my other videos, but I'll also divide it into smaller segments over time so you can revisit specific portions easily. Whenever I prepare a video, I ask myself two questions. Does this topic genuinely matter to me, and will it truly help someone else? This one is a yes to both. My hope is that by the end, you'll feel confident and well prepared. When you turn 65 and select your Medicare coverage, you are not simply choosing insurance for the next year. In many cases, you are establishing the structure that may shape your healthcare for the rest of your life. Here's what many people don't realize. Reversing that decision later can be very difficult. On paper, it can look simple. Enrollment periods exist, switching appears possible. But when you speak to people who have tried, you often hear words like complicated, expensive, or even impossible. That is why this matters so much. This decision influences what your retirement healthcare experience may look like at 65, at 75, at 85, and beyond. Today, we're starting from the very beginning. You do not need any prior understanding. We'll walk through what Medicare actually is, what Medicare Advantage means, what Medigap is, the crucial enrollment window at age 65, the real advantages and disadvantages of each option, lesser-known details that many people wish they had understood earlier, realistic cost examples over time, and finally, a simple decision framework to guide you. By the end, you'll understand why this is one of the most important healthcare decisions in retirement and how to approach it calmly and thoughtfully. When you first enroll, around age 65, you begin with what's called Original Medicare. It has two primary components. Part A covers hospital care. Part B covers doctor visits, outpatient services, testing, and procedures. For most individuals, Part A does not require a monthly premium if you've worked and paid Medicare taxes. Part B does require a monthly premium, and you'll continue paying that regardless of which path you choose. Here is a key point. Original Medicare does not cover 100% of your medical expenses. Typically, it pays about 80% of approved costs. You are responsible for deductibles, co-payments, and the remaining 20%. Another important detail is that Original Medicare does not include an annual out-of-pocket maximum. If you face a serious illness or require extensive treatment in a given year, your personal costs can become significant. Because of those coverage gaps, most people do not rely solely on original Medicare. Instead, they choose one of two primary paths, Medicare Advantage or Medigap. This is the fork in the road. Let's begin with Medigap. Medigap, also known as Medicare Supplement Insurance, is designed to fill in the coverage gaps left by original Medicare. It does not replace Medicare. It works alongside it. Here is how it functions. Medicare pays its share first, then your Medigap policy covers most and, in some cases, nearly all of what remains. In practical terms, that often means very little out-of-pocket expense when you see a doctor or are admitted to the hospital. There are important characteristics to understand. Medigap policies typically carry higher monthly premiums. In exchange, your costs become far more predictable. Many plans cover hospital deductibles, coinsurance amounts, and much of that 20% not covered by Medicare. You also gain broad flexibility. You can generally see any physician nationwide who accepts Medicare. There are no network restrictions and no referral requirements. The trade-off is the higher monthly premium, and you will also need to purchase a separate prescription drug plan. Premiums can range roughly from $100 to $300 per month, sometimes more, sometimes less. This is in addition to your Part B premium. So if your Medigap premium is $200 per month, that's $2,400 annually plus your Part B payments. A simple way to frame Medigap is this. You pay more each month to reduce the risk of large unexpected medical bills later. It emphasizes predictability and flexibility. Now let's look at Medicare Advantage, which operates differently. Medicare Advantage replaces original Medicare with a private insurance plan. These plans are offered by private companies and approved by Medicare. Once enrolled, the plan becomes your primary coverage. Medicare pays the insurer, and the insurer sets its own rules, co-payments, and provider networks. Most Advantage plans include hospital and doctor coverage, prescription drug coverage bundled together, and often additional benefits such as dental, vision, hearing, and gym memberships. One major appeal is the low monthly premium. Many plans cost $0 beyond your Part B premium. In some areas, there may be additional monthly premiums ranging roughly from $20 to $60, but overall, they tend to be lower than Medigap premiums. However, you typically pay co-payments for doctor visits, specialist visits, hospital stays, and you must follow network rules. Many services require prior authorization. Zero premium does not mean zero cost. Most plans include an annual out-of-pocket maximum to limit worst-case expenses, but those limits are often several $1,000s. A more comprehensive plan might cap at around $3,500 to $4,500 annually. Mid-level plans may range from $4,500 to $6,500. Higher exposure plans can exceed $9,000 annually. Prescription drug expenses are usually separate. In essence, Medicare Advantage shifts more cost to when you actually use care. It often resembles employer-sponsored coverage. So what are people choosing? As of 2025, approximately 54% of Medicare beneficiaries, about 34 million people, are enrolled in Medicare Advantage plans. That means more than half choose this path. Among those who remain in traditional Medicare, many purchase Medigap coverage. Estimates suggest that roughly 20 to 30% of all Medicare beneficiaries have a Medigap policy. You generally cannot combine Medicare Advantage with Medigap, which is why those statistics are reported separately. Over the last decade, Medicare Advantage enrollment has substantially grown and now represents the majority choice. Medigap remains smaller, but still significant. You might wonder if these are truly the only two options. For most retirees, yes, but there are additional categories worth mentioning. Some individuals retain coverage from a former employer, union, or military service. This coverage often coordinates with Medicare and may function similarly to a supplement plan, sometimes including prescription drug coverage. Lower-income retirees may qualify for both Medicare and Medicaid, referred to as dual eligibility. Medicaid can assist with premiums, deductibles, co-payments, and even long-term care, which Medicare does not cover. A small group remains on original Medicare without additional coverage. The rapid expansion of Medicare Advantage has not occurred by chance. Three primary forces contribute to this growth. First, Medicare Advantage receives strong institutional support within the Medicare system. Second, insurers and brokers have financial incentives aligned with these plans. And third, the structure of Advantage plans can be easier to present and enroll in at age 65. Your most important decision window occurs at age 65. When you first enroll in Medicare, you have the greatest flexibility and the strongest consumer protections. Federal rules provide a one-time 6-month Medigap open enrollment period. During those 6 months, Medigap insurers generally cannot deny coverage, charge more due to health conditions, or impose waiting periods for pre-existing conditions in most cases. Later on, the situation changes. People often hear that they can simply switch plans whenever they want. Technically, you can move between Medicare Advantage and Original Medicare during designated enrollment periods. But switching your Medicare structure is different from qualifying for a Medigap policy later. Outside the initial enrollment window, Medigap insurers typically require medical underwriting. So yes, you may be able to leave a Medicare Advantage plan, but you may not be able to secure Medigap coverage afterward. It's also helpful to understand why individuals choose to switch plans. The motivations for moving from Medicare Advantage to Medigap are usually very different from the motivations for moving in the opposite direction. Understanding those reasons provides important context. Let's outline the strengths and weaknesses of both options. For Medicare Advantage, we have clear advantages, and there are clear drawbacks. For Medigap, there are strong benefits, and there are trade-offs. A simple summary might look like this. Medicare Advantage often prioritizes lower upfront costs with greater variability later. Medigap prioritizes long-term predictability and flexibility. There are nuances many individuals do not fully grasp when making their initial choice, yet over time, these details can significantly affect their experience. Let's bring this into focus with realistic examples. We'll look at several individuals in different circumstances and compare how costs might unfold. At its core, this decision reflects a fundamental trade-off. Medicare Advantage generally offers lower upfront costs with greater variability later. Medigap generally involves higher fixed monthly costs with fewer financial surprises over time. So, how do you decide? Instead of becoming overwhelmed by dozens of plan details, think of this as moving through a simple decision tree. We'll walk through it step by step. Ultimately, this decision represents your long-term healthcare strategy in retirement. There is no universal answer. There is only the answer that aligns with your health, your finances, and your priorities. Now that you understand the landscape, you can move forward thoughtfully. I'd love to hear your perspective. Are you leaning toward Medicare Advantage or Medigap? If this discussion was helpful, please consider liking the video. If you're new here, subscribe so you don't miss future content. And if someone in your life is facing this decision, feel free to share this with them. I'll see you in the next video.